A public hearing also held today in Augusta on a bill that supporters say protects a program that benefits rural and underserved healthcare providers.
The 340B federal discount program provides safety net providers the ability to buy certain drugs at a discounted rate. The program has been around for decades, but supporters say in 2020, pharmaceutical companies found what they call a loophole to restrict it. The bill discussed today prohibits manufacturers from limiting the amount of pharmacies a provider can work with.
Supporters of the bipartisan bill say it won't raise taxes for Mainers. They say the change is essential with an already stressed healthcare system. Opponents claim the program was created to serve patients but has turned into an unchecked revenue stream for hospitals.
LD 1018 is not about expanding access for patients or ensuring that they benefit from the program. A pharmacy's designation as a contract pharmacy has no bearing whatsoever on whether or not a patient can pick up a prescription, only whether a covered entity can pocket the 340B discount.
So this is making it much worse, and it's a program that doesn't cost the taxpayers or the state any money, right? This is a program that sort of allows some of the profits that would otherwise flow to pharmaceutical companies to flow to safety net providers to support people who otherwise wouldn't be taken care of.
The Maine Hospital Association provided testimony in support of the bill.
They say this is the most important bill for them this session as they are losing an estimated $50 to $60 million in savings annually due to the restrictions.